Hello, today we are going to cover what we call mental health and psychiatric nursing. We are progressing with the same unit, which is done by Kenyan nurses. Okay, we had discussed broad array on the same. We initially discussed things to do with mental illness. We actually know that World Health Organization mentioned health actually as a complete state of physical, mental, social, spiritual well-being, and not merely the absence of disease or informity. So this is the thing. So if mental is mentioned, so to mean mental is also a key thing, and they have correlation between body, spirit. So if you are mentally unstable, even the body can deteriorate, as I say. So today we are going to check on what we call the classification of mental disorders. We need to differentiate between two major systems classifying mental disorders and then classify mental disorders according to each classification. Now, we have two main systems, that is International Classification of Diseases, that is ICD, okay? You really need to know this one. ICD actually assigns codes to the condition. So when I say code 25, you need to know there's something else, be it malaria, be it typhoid. So what I'm trying to say is that when you are a health record student in Kenya, you have to know all the conditions based on the International Classification of Disease. Sometimes I can talk in codes. Doesn't mean that that is not a disease. No, it's just a language which I can use. It's labeled, diseases are labeled in codes when you are internationally classifying them. Another main system is Diagnostic Statistical Manual of Mental Disorder, DSM. DSM is known DSM 5, DSM 4, so DSM 5, okay? That's the fifth edition. DSM, say Diagnostic Statistical Manual of Mental Disturbance or Disorders. Now let's check on DSM. DSM is a neurodevelopmental disorders, and schizophrenia spectrum and other psychotic disorders are there. The bipolar and related disorders also there. Depressive disorder, anxiety disorder, obsessive compulsive related disorder, trauma and stress and related disorder, dissociative disorder. Dissociative disorder, please. Dissociative disorder is so bad. Anyway, somatic symptom and related disorder also there. Feeding and eating disorder is there. Elimination disorder is there. Sleep wake disorder is there. Sexual dysfunction is also there. Gender dysphoria is also there. Disruptive impulse control and conductive disorder. Substance related and addictive disorder is also there. Now, this is the thing. Schizophrenia spectrum. When I talk about that, that's just developmental conditions. Mostly is on pediatric, but even adults. Okay, and it also can come after alcohol withdrawal. Neurodevelopmental disorders like autism on the spectrum. Okay, bit virtual classical autism. Bipolar related disorder, these are mood disorders, okay? The extremist or the lowest and the extremist, okay? Then we have depressive disorder, the depression. People come from depression, people go through depression, people go through depression because of loss of a loved one, because of a broken relationship. And then you have obsessive compulsive related disorders, okay? Then you have trauma, stress, and related disorder, and then dissociative disorders. Okay, so we're going to check each of them. Still, we have neurocognitive disorder, personality disorder, paraphilic disorders, other mental disorders, medication-induced movement disorders, and other adverse effect of medication. Like medication-induced movement, there are many. You can have tenesmus, we can have, tetany. We can all this one depends with what do they do, what is their pathophysiology. Okay, so the conditions that may be a focus of clinical attention, like we talk about international classification of diseases like neurodevelopmental, so we're going to check on that. Schizophrenic spectrum and primary psychotic disorder, bipolar related disorder, depressive disorder, anxiety and fear related disorder, disorders specifically associated with stress, dissociative disorder, bodily stress disorders, and psychological and behavioral factors associated with disease classified as well. Okay. Away from all these ones, you see they are all labeled in the code. If you're watching YouTube, these videos, see they have 0505B, 05A, 05C, so on and so forth. They are all here in terms of code, okay? So let's check quality of a psychiatric nurse. One, if you're a psychiatric and you're handling people with all these conditions, one thing that you're expected to have is that the respect of the patient. Second, availability. Madharau, yani disrespect is not tolerated, okay? Availability, you always must be there because somebody somewhere can be at their peak and therefore they'll end up taking or swallowing drugs or medication. You must always be there. Some will even knock themselves on the head, on the window. Yeah, some will overdose themselves, some will be making noise, some will be fighting one another. So you must always be there. Spontaneity in decision making. You have to make certain and factual and actual decisions. So it's spontaneity, okay? Acceptance. You have always to accept them the way they were or they are. Sensitivity. You have to be sensitive. Accountability, you have to explain and let other people know why and how you're doing what you're doing. Then empathy should be on their shoes. Self-understanding should understand yourself and permissiveness and firmness on your decision, skill observation as well. So that is that. That is that. And a key thing, the assessment of mentally ill person, what we're going to check on the next topic. But meanwhile, that is very adequate for the moment. Your examination just come from that, Isaac.